Welcome to Learning and Teaching Systemic Therapy podcast, the official Society for the Teaching of Marriage and Family Therapy, STMFT in short, podcast. I'm your host, Dr. Sofia Georgiadou. I created STMFT in this podcast as an antidote to the isolation I experienced as an early career academic. I also created STMFT in this podcast as a space to allow myself and my colleagues to share resources and bridge the way we do systemic therapy with the way we teach systemic therapy in our classrooms. Today, I have an amazing discussion lined up for you. Our discussion features questions I sourced from a Ph.D., another early career educator in our field, and we have an experienced MFT professor here with us who's navigated academia for many, many years now, and she's here to share her experiences and insights. Here with us today, we have Dr. Lisa Merchant. Dr. Merchant is an associate professor and director of the Marriage and Family Therapy program at Abilene Christian University. She's also the chair of the Department of Marriage and Family Studies. Dr. Merchant is an alumna of ACU, and she earned her doctorate of Marriage and Family Therapy at Texas Tech University. Dr. Merchant facilitated a batterer intervention and prevention program until last year. She's currently the presiding member of the Texas State Board of Examiners of Marriage and Family Therapists, and she's the state delegate to the Association of Marriage and Family Therapy Regulatory Boards. She has 2 adult sons, could eat tacos for every meal, and she loves plants despite her brown thumb. Oh, I have one of those as well. Welcome, Dr. Merchant.
Thank you for having me. I'm excited to be here.
Awesome. The early career educator we have with us today is Dr. April Nisan Ilkmen, LMFT. Dr. Ilkmen received both her master's and PhD degrees in couple and family therapy from Adler University in Chicago, Illinois. Dr. Ilkmen is the clinical training director and assistant professor of marriage and family therapy at Northern Illinois University. Dr. Ilkmen's teaching and clinical interests are related to attachment in romantic relationships and issues of social justice in the field of psychotherapy. Dr. Ilkmen grew up in Turkey, has lived in Canada, and now resides in the US. Her immigration experience and multicultural background allowed her to become a culturally sensitive clinician and professor. Her clinical approach is the attachment-based model, emotionally focused therapy, a model that permeates her clinical practice as well as her teaching and supervision methods. Her approach to therapy is informed by psychodynamic models, helping each individual to understand the unique struggles in the past and present in order to facilitate internal change. Dr. Ilkmen practices in Turkish, French, and English. Dr. Ilkmen is currently enrolled in psychoanalytic training program at the Chicago Psychoanalytic Institute and in ongoing psychoanalytic supervision. Welcome, Dr. Ilkmen.
Thank you. I'm very happy to be here today.
Fantastic. In this episode, we'll be exploring questions that have been pre-sourced from Dr. Ilkmen, which will be answered by Dr. Merchant. I'll be facilitating the conversation by sharing these questions, and I'm excited to hear Dr. Ilkmen's perspectives and context about these questions. So without further ado, let's dive into our first question. Why is it important for MFT students to strengthen their theoretical skills earlier compared to other counseling-related fields? I'm wondering if Dr. Ilkmen could provide some more context about that one.
I think this is a very important question because it's asked to me by students who are applying to the MFT program, and also by other colleagues who are in the mental health field, but not MFTs. They ask me this question on why we're so big on theory. And I think this kind of has a multi-layered answer. To me, first one is how our field really emerged and what was happening at the time and why people see a need to come up with a division like this, which turned into its own thing over time. But most people who started systemic thinking and providing family therapy were, psychodynamic therapists, psychoanalysts, and they realized that certain issues need to be addressed a bit differently. And the theory that they had at the time needed some some padding, which I think it pushed people to come up with a structured, very specific theory that has specific interventions to build some type of credibility and to prove that there is a need for it, and this is how it works, because now we're seeing improvement in a context and we can track it. So I think that's why in the first place we have the theories. Now, why it's important to train our students in this is, I think, the tradition that we're trying to keep up, and why we have such field when we have so many counseling degrees available. And also to make sure that students know what to do when they're in the room with the patients or with the family, and they have an idea. So we add a little bit to the basic counseling skills, because what they're dealing with when you have multiple people in the room, there is more urgency in terms of I think having a trajectory, which is a little bit different than counseling. Again, my personal take is that there is this need that was put on us at the beginning, that there's a need for MFT and that it's actually working. And I think that needed to be backed up with theory.
Yeah, I think that's a very interesting perspective. I'm wondering what Dr. Merchant thinks about that. Would you agree, disagree? I mean,
No, I agree. When I was a student, one of the axioms here at Abilene Christian was that theory drives practice. And I'm assuming that's probably not unique to ACU. They probably say that everywhere. But just this idea that theory drives practice. So theory is going to drive how you assess, what you assess, how you conceptualize what's happening in this particular client system. It's going to drive the interventions that you then do. It's going to drive your markers for progress, like how you even know if change is happening. And so in my mind, there's probably maybe two different ways to approach treatment. You can approach treatment from a theory-based perspective, or you can approach treatment from like a population-based perspective, where you say, well, this person has depression, so I'm going to treat it this way, or this person has an affair, so I'm going to treat it this way. But common factors research has found that like taking a population-based approach really isn't any more effective than just working from one really good theory. And so, you know, and even if you are taking a population-based approach, you're still working from a particular theory in order to address whatever that particular issue is. And so again, for me, the importance of it is just that theory is going to drive what you see and what you do in the therapy room, and that's why it is so important. I do want to say, though, that there are other skills that are also important, that theory is not maybe, you know, the only component of effective therapy, that we do need to learn skills like being empathetic or listening or setting goals or being able to direct a session. But I don't think that skills alone are enough to constitute treatment, that you still need interventions, and to have an intervention, you need to understand why you were doing that intervention. You need to know what the mechanism of change is, you need to know what the target of change is, and that's what your theory tells you.
you kind of went into explain also some of the benefits perhaps of even approaching or learning about a theoretical orientation, especially while you're in school, like during your master's program. I'm wondering, in your classrooms, what are some tools to facilitate choosing a theoretical orientation? How do we help students choose a theoretical orientation? And then I would like to know more about how do we help them develop their unique therapy style. But first, let's talk about how do we help them choose a theoretical orientation?
I don't know if it's necessarily about tools per se. I think, to me, what helps students choose a theoretical orientation is first they have to have exposure to a variety of models, so they actually have like something to choose from. So I'm a big supporter of exposing students to a lot of different models. They have variety. I think the second component is being able to practice those models and to actually experiment with them and get some experience actually using them. But I don't think that practice and experience alone is enough. I think there has to be self-reflection. And I think that that's where supervision comes in. I know that my students have a tendency when they come to supervision is they want to talk about the clients that aren't going right, you know, the things where they're stuck or they're struggling. But I like to talk to my students sometimes about the clients that are going well. And so I will sometimes say, tell me about your client who you've seen the most progress in. And then they will tell me about that client. And then I will say, so what are you doing to make that happen? And then we will spend time talking about what they're doing, you know, how they've assessed, how they know progress is happening, what kind of interventions they're doing, what is working. And I think it's that self-reflection because as they're doing that, sometimes they don't know. Like sometimes they're like, I don't know what I'm doing. I'm just like doing this. And so as they're telling me, I'm going, okay, so what I hear you doing there is, so you're taking a multi-generational perspective with them, or you're doing these in the moment kind of here and now interventions with them right there in these rooms, these enactments. Like, and so I'm listening for like those theoretical components and what they are already doing. And I'm trying to connect that so that way they can see it. Does that kind of make sense?
Yeah, it makes
Okay.
sense. Dr. Ilkman, did you have any thoughts on this question?
Yes, I think I agree with Dr. Merchant, and I think it has a lot to do with the reflective part that's going to come from the students. I think it starts with case conceptualization, and then because when in supervision you look at how they are conceptualizing the case, then I think it's okay from the supervisor or the professor to provide some guidance. And I know people have mixed views on that, but I see value in some type of, like, let's say, gentle guiding, right? Like, for example, I think I can pick up on natural tendencies of some students with their cases, right? Like there are students who are just, they look into power a lot, let's say, in this family naturally, right? Then like maybe suggesting some Minuchin readings can be helpful for that student. I think pushing yourself to do something that just doesn't naturally come to you is, that will expire at some point, it would exhaust you. So I don't know, this is a tool. I really believe that, your natural tendency in how you believe change will happen should mix with the theory that's the closest to that. And
Yeah.
that's evident in case conceptualization with students. So that would be, I guess, we could call that a tool.
Yeah, I think what Dr. Merchant said about self-reflection kind of connects to conceptualizing a case for sure. And where does our natural tendency go? Like, how are we thinking about change and forming that theory of change when you first start working and practicing therapy? Thinking about helping students develop their unique therapeutic style. How do you think that evolves over time, at least seeing it in your experience working with students at different phases of their education? I'm going to start with Dr. Merchant.
I have actually started de-emphasizing with my students this idea that they need to choose a model. I value theory. I don't think you can do effective therapy without a theory. However, my students often experience or feel a bunch of pressure, like they have to choose a model and they have to choose the right model, and then they are going to have to use this model for like the rest of their life. I have just found that that amount of anxiety is just not helpful for them. And so I have actually started kind of de-emphasizing this idea that they need to even choose a model at this point. Okay, I'm going to try out an analogy. There's an analogy I've come up with. I have not tried this out on students yet. Y'all get to be the first ones to hear it. Hopefully this analogy works. But I am going to start telling my students that choosing a model is like being a contestant on Love is Blind. So in Love is Blind, you're in these pods, you do like this speed dating thing, and then eventually you ask somebody to marry you, and then you go and you like do this whole honeymoon thing. And so I'm going to tell my students that their first year in the program is like where they are just in the pods, they're doing the speed dating thing, they are talking to a bunch of different, other contestants, talking to a bunch of different models. And as they're doing that, they're figuring out how to ask questions, how to dig for information. Like, so they're developing those kind of basic skills while they are like kind of getting to know all the different model options. Their second year in the program is where they start going on the longer dates. So in Love is Blind, once you kind of like settle on maybe 2 or 3 people that you like, you start going on like these 2-hour dates. And so to me, that's what you do in your second year is you're finding some models that you think that might be yours, and you are spending a lot more time with them, trying them with different clients, figuring out how to ask questions, figuring out how to do the interventions. And then for their comprehensive exam, when you sit down to write your theory of change paper, that's when you actually pop the question. That's when you ask that model to marry you. Like that's when, and it's not then. So it's not until the very end of the program when you're writing that theory of change paper that you pop the question. And then after graduation is when you get to go on the honeymoon and you get to try it out in the real world and you get to figure out if this is actually going to be a match made in heaven or not. And to extend the analogy, it's okay to be polyamorous. And so if you want to have multiple models that you kind of draw from, like that that's okay too. I don't know. I just feel like moving away kind of from this emphasis of you have to choose a model. I don't know. I just feel like our models change over time. You know, the theoretical orientation that we have is going to change over time. And honestly, once you leave the program, you might go work for an agency where you're only allowed to use one model, you know, where they say, we only do CBT here, or we only use TBRI, or we only use, you know, trauma-based CBT. And so you know, then you're going to choose a supervisor, and that supervisor might have a particular model that they work from, and that's also going to influence the way you do therapy. And so I try to encourage my students that at this point, you're trying a bunch of models, you're holding them lightly in your hand, because eventually these are probably going to morph and change over the course of your career.
Yeah, agreed. I haven't seen Love is Blind, but I am intrigued by the analogy. It makes me want to watch this show. Dr. Ilkman, thinking about this evolution of like someone like a student's unique therapeutic style, what have your experiences been with that, witnessing this process with students?
This is something that I think it's pivotal for supervision.
Mm.
I think I agree with Dr. Merchant on this push to pick one theory. And how did we do that? Was basically there are some textbooks written by each theorist, right? And they had to read and choose. I agree that it doesn't quite work that way. And there should be some flexibility. You need to answer questions like, how am I achieving change here, right? That's I think that should be there. They need to be able to answer that question, and that doesn't really mean pick one and stick to one, but I think it comes with intentionality.
Mm.
And the intentionality, I think, needs to be, it has to function with countertransference reactions of the students, especially at the very beginning, right? What's coming up for them needs to be addressed, I think, really early on, proactively. And I think that's intensive process, both for the supervisor and for the student, because then if they are shying away from certain things, that could be addressed. And you know, maybe we don't know where that conversation is going to go, right? Then maybe that's going to have an impact on how they view theory too. Maybe they do like to be more confrontational with their patients, but something is coming up and they never want to go there, right? So I think it's important to explore that a little bit, right? What's coming up for you? Why do you find yourself always leaning into one partner here? And kind of just, you know, what would happen if you asked this question a little bit? Or, you know, I'm curious why you always, I think those are good ways to explore, like just start off exploring countertransference reactions of students, because it's terrifying at the beginning. I think it's very anxiety provoking thing. So I think with the self of the therapist, or I call it countertransference stuff, that's how the evolution of creating a therapeutic style starts for students.
Yeah.
I agree with that completely. One of the other things that I'm sure you've probably noticed too is that like my students' model will change as they gain confidence in the therapy room. That I think students sometimes are maybe like turned off by the more directive models because they feel like, oh, I can't do that, you know, or they don't have like the confidence. And then they're like, oh, I'm going to be collaborative. Like all my students early on, are like, I'm so collaborative. Like I'm just, you know, that's what they want to be. But then they discovered that really doesn't fit with who they are as a person, that doesn't really it just doesn't fit their personality. Like, and so as they gain confidence in the counseling room, they realize that they actually can be directive. They can do enactments. They can tell clients what they think. They can, you know, confront clients. They can direct the session. And so then I see their model start shifting maybe more towards our more directive models. So yeah, so definitely, I definitely think countertransference or like that self-therapist stuff definitely impacts.
You're talking about directive models, Dr. Merchant. Are you referring to like some of the first wave models, like the strategic models, MRI, things like
Yeah,
that?
or even EFT
Solution
is
focused.
directive.
Also, I think, you know, it's our responsibility to be honest about what's waiting for students if they want to branch out. It's good to prep them and be honest.
Yeah. I
With-
mean, certainly about the MFT exam, we have to prep them like you're about to study like 20 different models just for the exam. Like, so prepare yourself mentally for that. And I think between what Dr. Merchant described and kind of a more integrative approach that's like someone's unique therapeutic style, we have this transition from like someone experimenting with everything and nothing, and then figuring out like a more integrative approach, but being able to explain like why
Mhm.
am I doing things a certain way, or how does this all thread together? Like, where is the common thread that I'm drawing throughout these different, ideas or concepts from different models, etc. I think students need to be able to articulate that, and at that point, then I wouldn't call them eclectic. I would call them integrative in their approach when they're able to like say
Mhm.
this is how
Mhm.
all lines up together, and how it all makes sense, even if I'm using things from 3 or 4 different models with
Mhm.
any given client. Supervision, of course, and live supervision and processing recordings of sessions is a great way to do that. I've also had students transcribe maybe like 3 or 4 exchanges, like short exchanges with the client. And speaking about countertransference earlier, Dr. Ilkmen, one of the things that I had them write about each exchange was what they were experiencing, like body sensations, thoughts, and feelings during the exchange. And so that kind of helped them slow down and reflect, like in that particular moment, what was going on for me, which I think is very helpful, a part of the learning process. Thinking about helping students bridge theory and practice, what are the challenges that we have seen them face, and are there specific strategies that we use to help students bridge theory and practice?
Yeah, I think probably the two biggest challenges I see, one is taking systems thinking and actually applying it in the therapy room. I think that we just live in a culture that is steeped in individualistic thinking, that our society just kind of says that the locus of pathology is in the individual. And so it's kind of hard sometimes to undo like their programming, for lack of a better word. And so I have found, honestly, that I think it's easiest for us to, I don't feel like my students really get systems thinking until the start of their second year. And it's usually in the play therapy class. And the reason it happens there is because they do these case conceptualizations, and I'll talk about those in a second, but they do these very specific case conceptualizations, and as a part of their treatment plan, when they're putting together their case conceptualization, like they'll maybe have like, say, a child who's 6 and who's coming in because their parents are getting divorced and there was domestic violence, and the child is, refusing to go to their dad's house, or their child is, having these angry fits. And then the treatment plan will say something like, teaching child emotional regulation, teaching child, how to manage grief, processing emotions with child. And then I can come back and I can say, so why are you putting the burden of change on a 6-year-old? This is a 6-year-old. Why is a 6-year-old responsible for managing their own emotions? Why is a 6-year-old responsible for creating change in the family? Why is a 6-year-old like, who really needs to be the burden barrier of change in this family? Is it really the 6-year-old, or is it maybe the parents? And so whenever we can start having conversations around those things, that's where I think for my students, this idea of systemic thinking
Yeah.
starts clicking, that the problem isn't the 6-year-old and their inability to manage a very, very difficult situation that adults sometimes have a hard time managing, but the problem is located in the system. And so that to me is where I feel like systems thinking really begins for my students, is the beginning of their second year. And so some of the tools that we use, or that we started using to help them, I guess one of the other problems that I run into is sometimes, like when it comes to just applying theory um, to practice, is they sometimes just feel so huge. And
Mhm.
so when we do our case conceptualizations, we kind of break it down into like the smallest parts that we can. So that way they're taking it in little chunks, as opposed to like, because really their mind goes straight to, how do I intervene? How do I fix this? And so like getting them to go, whoa, 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 let's slow down. Okay, we got to understand this client's history. We need to understand the history of the problem. We need to know if there's any kind of diagnosis going on. We need to know if there's any safety considerations. We need to know if there's any other contextual considerations that are really important. Okay, now let's apply theory. Okay, now we're gonna like, how do we explain what's happening here? What are we actually targeting with our interventions? Like, what are we actually trying to change? Now let's get to how we're actually going to do that change. Okay, now what are the interventions we're going to do that's going to target that thing that needs to change? And then finally, how are we going to know that progress has happened? Like, how are we going to be able to know that the client is actually benefiting from what we're doing? And so if we can just kind of slow it down and break it down into components, it just makes it easier for my students to really apply what they're learning in the classroom, apply these theories to what they're doing in the therapy room.
Yeah, I love this. Are you describing an assignment that is scaffolded over a few weeks, Dr. Merchant, or
It is
how does that happen? Yeah.
Yeah, it's a assignment that they do starting the very first, the very like second week of the program. You know what I mean? Like they start creating these case conceptualizations. There is scaffolding that has to be done, of course, because like their first week in the program, they don't know how to diagnose. But still, it's still on their little sheet that they have to fill out. Like, and I just tell them, I know you don't know how to diagnose yet, but if you want to crack open your DSM and take a shot at it, you're welcome to. I'm not going to take points off if you don't get this right. But at least they are already from the very beginning, we're already training them to think about these things. Or like they don't know genograms yet. And a part of it is they have to put a genogram on there. And I'm like, I know you don't know genograms yet, but like take a shot at it. And I'll give you feedback. But I'm not going to take points off if you don't get it right because you haven't learned it yet. So there is some scaffolding that happens, but I want them already from the get-go, already thinking in terms of
All the
thinking
different
in terms of
components.
these different components.
Yeah. Awesome. I love this. Dr. Ilkmen, any thoughts?
One thing I would add, and why our field is unique, is also systemic thinking doesn't only mean family members. It also means dimensions of culture, which we were able to incorporate into our clinical thinking, and we are still finding ways to do that. And it takes willingness from the supervisors, from the professors, to kind of bring that into supervision and into classwork, and navigate with your students how they can where they stand about this stuff also. And if they're not interested, what stands in the way of them being interested in such matters? Because it will, I mean, I don't really see how in any therapeutic setting how they don't come into play, because the second that the patient walks in the room, they're sitting there with their race, ethnicity, age, everything, and we are also there visibly, and a lot is already happening, right? So I think informing the students on what that means and how that may be playing a role in the therapeutic relationship is so crucial. And we see a need for that, which is different than other fields. I think that, now we have a theory for it, right? Social justice theory is a theory itself, and it's remarkable, and it's really valuable, and that I think it attracts a lot of people from marginalized communities to explore the intersection of issues of social justice and therapy. I think that's one very big thing there that's important when it
I
comes to.
definitely agree. But like one of the things I also started doing with my students to help them kind of understand just systems thinking and broadly is breaking down the different ways to think systemically. So we can think about systems in a here and now approach, that like we need to interrupt patterns that are happening right here in this moment, that we can think systemically when we think multi-generationally, that there are these patterns that are being passed down from generation to generation to generation. We can think systemically whenever we are thinking from like almost like a family developmental approach or from like an ecological approach. That we can think systemically also in terms of like language, in the way that like reality is socially constructed. And then we can think systemically in terms of things like culture and race and gender and socioeconomic status, that all of these things also, especially societies valuing or devaluing of these things, or privileging or not privileging of these things, and how that affects what our clients are going through. And so I agree completely with everything you said. And then just again, to add to that like, to me, that's another way that I help my students with the systemic thinking, is helping them break down all the different ways to actually think systemically, as opposed to as if there's just one way.
Yeah.
Yeah, I mean, I think we should be honest that there is a lot of work that needs to be done there, right? I think the terms we use are still very limiting, and these are things I'm exploring myself, right? So we have the term immigrant, for example. I mean, I can speak for myself, and I have some students coming in, international students. I was an international student at some point, and they tell me it makes a very big difference when you're first generation or second generation, right? I mean, if we're talking about attachment and what you introject, right, and what impacts you today, a person who spent the developmental years in another country is going to have a very, very different experience with how they respond to microaggressions, right? For example, they might not be able to pick it up as quickly as a second generation, which are very important implications because it's a huge term to put everybody under. And I think it's a disservice in understanding what's actually happening for the therapist and for the people. And this applies to, I think, all dimensions of culture, right? The reality of psychotherapy itself has been for people from the higher socioeconomic, it's a wider space, right, for people with the higher socioeconomic class. And we're focusing on emancipation and personal well-being, which is already a very off limits space for a lot of people of color, right? And the fact that they're coming in, what's okay to share in this space and what's not, right? There may be consequences that were through their experiences with institutions. They learned that it's not okay. All those things are a part of therapy, and I think all those things are the responsibility of the clinician to address. So it starts very early, and to be frank, it's definitely not easy, right? Because it's the most sensitive thing where you're going to be, understanding your own privilege and power while you're also trying to assess what's happening for them and still offer a safe space. So it's definitely challenging and takes a lot of willingness, but I think it happens when you're a student because they can still mold that with any theory, really. And I think it's crucial, and that's why I love our field so much, because we've been making space for that.
I agree. I mean, we can have another couple of hours of conversation about broaching cultural aspects in therapy. I'm wondering if there's any specific ways that we train students in our programs to do that. Role playing comes to mind, of course, role playing, kind of broaching specific topics or approaching the power differential between therapist and client, or approaching a racial difference or a difference in gender identity, etc. And self-reflection again plays a big piece here. And some of those assignments that we give students is about very much kind of figuring out like where are my blind spots and what is my intersectionality like, and where am I on this wheel of privilege and power. Is there anything specific, Dr. Ilkmen or Dr. Merchant, that you use to help students not only learn about culture, like from a theoretical perspective, but also kind of practice applying that skill of broaching cultural topics in therapy?
Okay, we have two assignments that I can think of just offhand, at least two that I can think of for my class anyways. One is I'm not sure if you're familiar with the ambient model from Bermudez, and I can't remember who else was the author on that paper, but anyways, we have students practice ambient, which is basically just noticing the way cultural values are being like basically how some cultural values are being undervalued or not valued, and how that might affect relationships. And anyway, so we have them practice things like the ambient skills. We also have them practice things like asking somebody, and it doesn't necessarily have to be, it doesn't have to be a client, but like having conversations with other people about their immigration narrative and like the things that were left behind, the things that they brought with them, their hopes, their dreams, like their fears, like their experience with once they got here. So like we have some assignments where they have to engage in these conversations in some form or fashion. There are other assignments we do, but they're probably more on the theoretical level and more on a shifting perspectives level, as opposed to like an actual practice of, as opposed to the actual practice level.
Yeah, thank you. Dr. Ilkman?
I do a few things about this. I'll just briefly summarize it. The first one being in group supervision, right? I think it's crucial that the students can talk about this in group setting, right? In the multitude of different differences, sitting and practicing to speak in that space is crucial. And it comes with some level of acknowledging their own power and privilege and how it's coming to play. So I ask them to kind of identify their own dimensions of culture, and kind of we talk about the spectrum, right? From the most dominant to the most oppressed, and they kind of situate themselves, and we talk about it. We talk about what's bringing that up, being open about it. We talk about what that is bringing up in other classmates, and what might be happening with this case in therapy and what that means. Because I think, and it's challenging and it brings up stuff for students and for me. But that thing that's coming up, right? That discomfort, that's also happening in the session. That exact thing is happening in the session most of the time. So we kind of enter that space together in supervision. I think that's the most effective way.
I love that discomfort where you're like at the edge of your growth zone, like proximal development zone, right? You're just uncomfortable enough to learn, but not uncomfortable enough so you're panicking, or you feel unsafe. It's a very sweet spot for learning, for
Mhm.
sure. As we wrap this up, I am wondering if we can maybe chat a little bit again. We can unwrap this and talk in much more detail. But do you have any thoughts about current trends in systemic therapy? Thinking about, telehealth, trauma-informed care, somatic-based approaches, and how do these influence how we teach systemic therapy in our classrooms with the generation of students that's coming through today? I'm going to start from Dr. Merchant.
Yeah, I think these are all important trends. And so we try to find ways to actually incorporate them into the program. However, we don't incorporate it until their very last semester in the program because I really want them grounded in systemic thinking before we start introducing how to integrate kind of non-systemic ways of thinking. Most trauma-based treatment is individualistic in nature. And even somatic-based, it's placing that locus of pathology within the person. I don't introduce it until later, but then again, like those same case conceptualization assignments, they do those same exact case conceptualization assignments, but this time they have to integrate, either a trauma-informed or somatic-based or ACT or DBT. Like they've got to integrate some sort of like individualistic thinking into their systemic way of doing things. And I think this is especially important because most of our students who leave here are probably going to go into agencies that are more geared towards psychology or social work or like other more individualistic ways of working. And so I want them to be grounded in that systems theory, but know how to like integrate these things into the work that they're doing in a way that doesn't, what's the word? I don't want to say corrupt, but corrupt kind of that systemic way of doing things. So we just try to teach them how to do it well. Again, it's always about like, what are you trying to accomplish in this moment? Like, are you trying to reduce symptoms? Are you trying, and if you're trying to reduce symptoms, there's nothing wrong with reducing symptoms. And if you're using DBT to do that or ACT to do that, that's fine. Are you using, because my students use EMDR a lot. And so it's like, you just need to know when and why you're integrating EMDR into your work. And that you're still looking at this as a system-wide issue. And that EMDR is basically going to be used in the service of helping this person get to a place where maybe they're not so, they don't have an emotional reaction in the middle of an argument that then results in the escalation to the police getting called or whatever. Like, so just trying to help them. I don't know. Does that make sense?
Mhm. Yeah, it makes sense to me. Yeah, you're incorporating individualistic approaches or like more the contemporary
Yeah.
models, but
But
still maintaining the systemic framework in mind.
right.
Yeah.
And so like last week we went to a place here in Abilene that does ketamine treatment. So we went and we learned about ketamine based and other psychedelic based treatments. This week we're going to all go do yoga and sound bath together to learn, again about more of these somatic treatments. And so I don't know, we try to show students that like they can incorporate these things into the systemic work that they're doing.
I love this. Yeah. I bring guest speakers. I don't
Mhm.
have a lot of opportunities for field trips like this, although that sounds great. but I do bring guest speakers in that present about this different, more contemporary approaches that I know nothing about and I want to learn also. Dr. Ilkmen, any thoughts on this question? Kind of bridging, current trends with teaching systemic therapy?
My mind went to the sex therapy programs that most MFT students also want to merge with couple and family therapy, and I see the benefit of that depending on what type of career that they will
What's the name of the program again? You mentioned
getting some type of training in sex therapy is
sex
a big
therapy. Okay, yeah.
trend that I'm seeing, and programs are incorporating classes for that too, MFT programs, which I think is very valuable. In terms of bringing in the trends, if something comes from my students that they're curious about, that they want to explore, I'm very open to it, I guess. And I try to help them find ways how they can, channel that into maybe what type of internship they will do. There are a lot of conferences that they could attend, and I think they should attend for a lot of purposes. And creativity is great, especially when you're a student, so I encourage them to channel that. I guess that would be where I stand with the trends.
Yeah. Okay, good. Awesome. Well, we're going to wrap it up here, but maybe there will be a part two of this conversation because I feel like we barely scratched the surface today. I want to say a big thank you to our fantastic guests, Dr. Lisa Merchant and Dr. April Ilkmen, for sharing their experiences on teaching marriage and family therapy with us. I hope their wisdom and experiences will help our fellow educators and listeners on their own academic career journey. Dr. Merchant, how can listeners interested in your work reach out to you? Is there a good email or other contact?
Yeah, best way to reach me is through my ACU email address, which is just lisa.merchant@acu.edu.
Wonderful. And Dr. Ilkman, how can listeners interested in your work reach out to you?
I guess my NIU email would be the best. It's eilkmen@niu.edu.
Wonderful. To our listeners, I hope you found today's discussion enlightening and inspiring. Be sure to follow our Learning and Teaching Systemic Therapy podcast episodes on Spotify and wherever podcasts are available. We have exciting episodes coming up every month, so stay tuned. At STMFT, we believe in the power of mentorship and the importance of representation in education. If you're interested in becoming a part of our mission or seeking guidance, for your educational journey in the field of systemic therapy, visit our website at stmft.coastmft.org and consider joining our educators Facebook group at www.facebook.com/groups/stmft. Thank you for joining us today, and until next time, this is Dr. Sofia Georgiadou signing off for STMFT's Learning and Teaching Systemic Therapy podcast.